can tell you my big challenge. I don't know you.
What were some of your biggest challenges with bedside report?
Keeping patient information confidential when there's double rooms. And I think when patients need and ask a million questions while you're giving report, just kind of learning how to maneuver through that and kind of getting through the report in a timely manner.
Or when there's visitors in the room, you don't know if they're related or not, and you don't know if you ask the patient if they want them to leave, if they'll feel comfortable saying that they want them to leave in front of them.
Yeah. Which, you know, to get around that, you can just say, are you comfortable with us giving report and your history in front of this person, or should we step outside while you're visiting? You know, because if the patient, you know, doesn't want you to do bedside report, that's fine too. Yeah. While they're visiting. Mm-hmm. So, you know, I think that the idea of it feels like it's going to take much longer than report, but once you start doing it, you find that it goes so much faster because you're not asking, oh, is the patient on oxygen? Oh, I can't remember. Oh, we turned them down. Like, you're in there. You can see whether or not the patient's on oxygen. You can see if they have fluids running. You can, you know, there's a lot that you can see.
I think a lot of times people will fear that people are going to ask questions or they're not going to know the answer. So a lot of times you're so busy that sometimes people don't get a full history or all the information in detail. So I think, like, when I first started, I was like, oh my gosh, what if I don't know what to answer? But that's why it's all on our sheet, so you're okay.
And the patients can help you out too.
Mm-hmm. Which is a good way for them to be like, actually, I have a history of this, or that's actually, this is what happened. So it's actually really good to be in the room with them so they can hear what's going on.
What do you do if the patient is sleeping?
Depends on what time it is.
Depends.
If it's night shift and they're sleeping, then we can let them be. Also just asking the patients if it's okay before they're sleeping, if to wake them up if they're sleeping during shift change. That kind of helps eliminate that problem.
And then when I come on for day shift, most of the people are sleeping, some of them are awake, but I'll just peek my head, and if they're asleep, I'll report outside of the room, and then I'll sneak in and check the fluids, check their IV while they're sleeping, if they're fully patent, if they're on any oxygen. That's what I usually do.
Yeah, and that's the same thing we do at 11 for a night shift. And,
Yeah.
and I think, too, that, you know, one of the things that people, you know, oh, the patient's going to, you know, ramble or ask this, or they're going to need this. And, you know, kind of when, I think it's a good idea, you know, when you're doing that last check on your patients, you know, at the end of your shift, you know, to remind them, like, oh, bedside report is coming, and we're just going to go through things really quickly.
Is there anything you need now before we come to that? Because a lot of times I'll tell my patients, you know, it's 15 minutes till 3. We give report at 3 o'clock. We will be in report, so we won't be able to get to you right away. So if it's not urgent, if we can wait until we come into the room or until about 3:30 when we're done with report, then you can call and ask for us. But if it is urgent, please call us. And most patients are like, oh, okay, and they get it.
Yeah.
Some of them forget, but that's okay.
How do you deal with sensitive issues that the patient may not be aware of?
You can always say some things outside the room before you go in. If you don't know that if they know it or not, because you don't want to open that can of worms.
Yeah, if it's something that you're just like, you know, if it's like a cancer diagnosis that you're unaware if the patient knows, if you just don't know, then I just quietly say it outside the room, kind of tell the situation, and then go and finish report on the bedside. Yeah. A lot of times they're aware that they've had a biopsy and they're waiting for the results, so they'll ask at the bedside, and then you just say, you know, I'll have to check to see if the results are back, but the doctor will be in to talk to you about that.
Or psychosocial behavior issues too, you know, just, so before we go into the patient's room, let me tell you this. You know, and that usually, then you're prepared when you go into the room, and doesn't necessarily come up at the bedside.
How do you deal with staff that are unwilling to do a bedside shift report, or just say, oh, just talk to me right here and I'll go in and see him later?
Really encourage them, you know, this is what we need to be doing. The patients really need to be involved with their report. And then you can also talk about how we can do our safety check at the same time.
I think too that if you remind them that like the patient's been getting bedside report, so if we don't go do bedside report, they're gonna miss you. Like they'll know that you didn't come do bedside report.
I just basically say, well, I need to go see him, and I need to make sure that I get all information. So, and I start walking to the room, and hopefully they follow. And usually they do. Or if they don't want to, and I'm getting a report from them, I just walk to the room and say, well, I need to get a report. So, and they're usually like, okay, and then it's fine.
So you want to get out.
I'm just pretty adamant that it's necessary, and I need it to be safe for the patient. So, yeah.
How does the bedside shift report help you with the rest of your shift when you receive it?
Well, it's nice to see them right there at the beginning and know things, because sometimes you do forget something like, oh, they're fully. You're going to find that out later, but if you're in the room, you bring a report, you can see it right then when you're there. And then if someone calls you get a report on them, or a doctor calls you before you would do your assessment, you've seen them, and you talk to them a little bit more than you would just with a normal safety check.
That's a big thing for me. Because sometimes you get wrapped up in one patient's room, but I've done this test. I know that their IV is fine, their fluids are correct, their drains are draining properly, their incisions look great, they're clean, their oxygen's fine. I've laid and done a whole head-to-toe assessment on my patient. I just haven't listened to their lungs or bowels, pretty much. And so I will be able to say that my patient is safe, and I feel like if I'm not able to get into the room for who knows, an hour or so because I'm stuck in another patient's room, I've laid eyes on my patient and I know that they're safe and they're fine.
And I think too, and maybe this is just me, but when you're getting that report in front of the patient, you are putting the story to the person. Like, you know, whereas if you're getting a report on 5 people, it's just going to a name. And I don't know about everybody else, but I don't always remember everybody's name, like all 6 of my patients. You know, but you're putting their story, what's going on with them, what their issues are with the patient, and not just the name or not just the diagnosis. And for me, it's much easier to keep track of all my patients. Thank you guys.
Okay.